And welcome back. On today's Health Corner, we're focusing on American Diabetes Month. It affects millions of Americans and can lead to serious health complications. Joining us now, Memorial Health System endocrinologist Dr. Ellen Caswell. Dr. Caswell, thank you so much for joining us today.
Sure.
Yeah, and this is important because, for one thing, Mississippi has a high number of diabetes cases in the state. And a lot of that has to do with lifestyles, and because we're talking about diabetes type 2. So let's start with that.
So yes, in Mississippi, we have about a 15% of our adult population struggles with diabetes. So when we talk about type 2 diabetes, things that contribute to your risk there, obviously diet is a huge part of that, increased carbohydrate intake and simple sugars, and then weight in general. So additional weight we usually talk about that in BMI or body mass index, is a huge contributor. So watching how we intake and what we intake as far as carbs and sugars and calories in general is a huge way to decrease your risk for developing type 2 diabetes, as well as increasing your physical exercise up to 30 to 45 minutes, 3 to 4 times a week, in those patients who know that they are already at risk.
Right, and from what I understand, even if you are already pre-diabetic with type 2, you can really change the course of that disease by changing some of those lifestyle factors oftentimes, and never fully develop diabetes. So that's the good news. The bad news is for people with type 1 diabetes, doesn't that have more to do with genetics? And I mean, there's really no way to prevent that oftentimes, right?
Correct. Type 1 diabetes differs from type 2 diabetes in that with type 1, it's almost a complete lack of insulin, as opposed to type 2, where your insulin is being produced, but just not at the level to control your sugars. And that's correct. Most in the past, we thought all type 1s were born that way. Now is more of a spectrum of diabetes. You can definitely develop type 1 diabetes as an adult. We call that latent autoimmune diabetes as the adult. And so we know that, diabetes is not as black and white as it used to be. But yes, in type 1, that is going to be your insulin dependent folks, and they will always need insulin. And those are the people that, really have to watch what they eat even closer to make sure that they don't get themselves into trouble.
We have come a long way, though, in terms of treatment, and we'll talk about that in just a second. But first, signs and symptoms of diabetes. We have those up now: increased thirst, frequent urination, unexplained weight loss, fatigue. If you have these symptoms, you should definitely talk to your doctor, right?
Absolutely. That's commonly patients that come into the office when they were diagnosed. They report absolutely all of those: increased thirst, running to the restroom all of the time, unexplained weight loss, excessive daytime sleepiness. So all of those things can be pointing to high sugar in the blood, causing increased urination, and then trying to recover from that by taking in large amounts of water. And so they get in that cycle, and they sometimes don't realize that things have changed until it's gotten pretty severe. So if you experience those, it's definitely a good idea to report those to your doctor so that they can test your labs.
Okay, important things for people to keep in mind, and we'll talk about treatment next time you're on, because we are out of time, but definitely treatments have improved so much, especially for people who require insulin. All right, thank you, Dr. Caswell, for joining us today from Memorial Health System.
You're welcome, and thank you for having me.